I have heard that from hundreds of people, whether it's on the internet or in person. I can't tell you how many doctors have told their patients that it's just in your freaking head. I don't care if it's in your head because it's real. Pain is real, and orthopedically, I just tested you, and neurologically, I just tested you, and something is real. It's happening. You have a history of a disc herniation. You have a history of discectomy. And some of the things that we deal with is not necessarily the compression to the discs themselves, but what we call the collateral damage that occurs as a result of surgical intervention as it is. So meaning if we go in there and we, quote, do some surgery and we cut open these muscles right here, we might, quote, take out the bad disc and replace it with a perfect disc, and it might be perfect for the rest of their life, but what about the scarring that can occur above it or below it? That's what collateral damage as a result of surgical intervention can do. But in your case, when I lifted, let me just double check. When you know that you've had the numbness and tingling going down in there. When you're having this disc kind of compression, it can come off and hit the nerve like that, right? So that's the difference between a disc bulge and a disc herniation. Kind of be the oozing of that disc that can kind of come down on there. I'm sure that maybe in the past you probably had the full-blown herniation, right? Right now it's probably not a full-blown herniation, but you're having what we call neural tension signs that are positive, which means that when we pull down on the nerves, when we pull down on the hamstring, when we pull down in certain directions, we find that you exhibit those symptoms. Those are very common in severe cases, but they're also very common in those people who have like small but subtle residual pain. When I lifted your legs to do this, that creates a lot of tension in the back. That tells us that you have a little bit of compression still going on. This is probably nothing new that you have heard, I'm sure, right? Posterior chain exercises are going to be absolutely important, but also healing that injury is going to be important. First things first, I always call it the baby steps of pain. Just like I'm sure there's basic baby steps or foundational training in weightlifting, right? Especially Olympic lifting, right? Or in your case, weightlifting, right? What we're going to say is figure out, one, what the heck this is, which I think you have a good understanding already what it is. I have an understanding of what it is already. Two, what is proper first aid, or what is something that reduces your symptoms and pain and discomfort? And then three, what is something that at the same time, maybe after, but the baby step 3 would be then what is something that irritates it further and stop freaking doing it. You would not scab pick the first aid, meaning if you cut yourself, you wouldn't start digging in and ripping out that scab that you just tried to put a Band-Aid on. So if you start understanding that right off the bat, I think then you can start moving forward, and maybe this is one reason why not just ART has helped you, but also has maybe not stuck. Because I think it is helpful, and I truly believe in it, and I believe that it will help you. But what are some skills and tools that we can do at your home and I think the nerve glides and slides are fine for you. I just think that you're getting some central disc compression, and when I say central, it means like, yes, it might be slightly off to one side or the other side, but generally speaking, it's like right in the center, and that's why you're getting some residual pain on both sides, but with more on that left. So we're going to have to play with some stuff, and see what you actually are capable of doing, because just ART in this case, like as much as I think you would benefit, just ART alone is not going to help entirely. Just strength training is not going to help. Just doing this is not going to help. You need a cohesive picture at this point, because it's kind of like frustrating you. So on a scale of 1 to 10, how much pain are you in right now?
Probably like 4.
Okay. What do you think is your major or basic limitation?
Like what I can't do.
Yeah, what can't you do that you'd like to do?
I guess it would just be like consistently sorry, I'm like arguing in my head. I ultimately want to get back to weightlifting, and I can't do that right now.